Hey y'all, Miss Ladybug here. I'm finding doing these little chats or videos at the end of the day when I'm all snuggled in works well for me. Maybe not the most professional looking, but oh well, I'm being me. And so this is me. You know, I I read I read a posting today, and then I had a conversation with a loved one about doctors gaslighting you. I know I experienced that. I experienced gaslighting and demeaning and shaming from doctors, from treatment providers when I was in inpatient treatment, from mental health providers. It makes you a little hesitant to ask for help. It makes it really challenging when you go to a doctor and you're going to them because they have expertise and they have the means to get testing that can give answers or give direction to healthcare. But frequently, and it makes me sad to say this, but if you have any history of mental health issues and they don't like what you're asking of them and they don't respect you as a human, they'll bring in your mental health issues and make you out to be off for questioning them, for asking for the things you're asking for. I experienced it to a degree with my most recent visit to a doctor. I recently changed doctors, and which is a really hard thing to do, but I moved and I couldn't travel 3 hours to get to a doctor's appointment. It just isn't not feasible. So I had to change doctors. And I was talking to her about my some of my post-COVID ongoing symptoms and how the fatigue is really becoming problematic at times. And she just is like, fatigue. That's just, very subjective. And there's not much we can test for fatigue. And I'm like, seriously? There's a lot. She did basic blood tests. I asked her to check my thyroid. She did a TSH and a T3, and that was it. That's not even close to a full thyroid workup. And thyroid I'm struggling losing weight. I mean, I'll lose if I only eat salads and literally only eat salads. I'll lose, but as soon as I eat anything, it's right back. So it's really hard to be medically damaged, medically fragile, and medically shamed. And it's really crappy. It's really crappy because they have a power of they can order tests or not order tests, and they can treat you or not treat you. And they let that go to their heads. Somebody recently that I know went to a functional medicine doctor to get some outside or a different perspective. And some testing was done and some findings were found and some recommendations were made, and then this person went to their primary care physician and they shared what they'd done and found out, and oh my gosh, their doctor completely lambasted them. It was just ridiculous. And brought up mental health. Oh, you should be seeing a therapist. You haven't been seeing a therapist, right? How come you're not seeing a therapist? I thought you were in therapy. You need to have therapy. You're really dysregulated. Da, 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 da. And all those medications you're on, except she's the provider writing the scripts. It's disgusting. It's disgusting. So what are we going to do? How do we rectify this? How do we, without just, going without medical care, which I do. I have a lot of things that I just deal with because it's not worth the hassle to argue with the doctor trying to figure it out. So I just live with it and figure if I die, I die. I'm not afraid of dying. So, that's not a big issue. It's the living in pain that kind of sucks, or living being uncomfortable. But truly, what do we do? How do we, as a collective, how do we approach the medical care people when they do this, and to turn it around and show them what they're doing in a way that's not demeaning, and maybe they don't even recognize what they're doing? People's egos, makes them behave in serious ways. Egos are big deals. But so you don't want to go shaming people yourself, tit for tat. That's we don't do that. But how can you respectfully turn it around and show the doctor, hey, can you look at this? Because this is how it's feeling for me. I don't know how to do that. That's why I'm asking you guys. I'm getting better at loving myself enough to say what I need. Like yesterday, what I shared about the car insurance and that whole 1 hour on the phone and telling the worker that I'm working with, the insurance agent, that I have brain damage and I don't understand things and I don't follow and track and I get irritable and to please be patient with me. And that person respected me as a human and did that. But not everybody does that. So those are the people that ooh, all right, I just don't even want you in my sphere. If they're not going to respect you when you're telling them what you need, they need to go. But learning how to tell people what you need respectfully and in a way, and then if it's coming badly, telling them, this is hurting me. I'm coming to you for answers, solutions, help, expertise, etc. And you're making me feel worse for asking. When that's your area of expertise, you should be, I would hope, feel uplifted that I'm trusting you with my life and with these questions. Anyway, if you have any input on that, I'd really appreciate it, because the medical gaslighting and shaming and demeaning of the medically injured and mentally disabled is wrong. And I will tell you, I've had it happen to me, and I made a complaint, and that doctor was reprimanded. I was in seeing someone who was not my own primary care physician for an illness, and they questioned what my mental health diagnosis was when I wasn't there for anything to do with my mental health. I was there, I had diverticulitis. Had nothing to do. But she wanted to know, and she was questioning my mental health issues to gaslight me that it was all in my head. And I filed a complaint. And I urge you to file a complaint. If you have a doctor or medical provider gaslighting you, demeaning you, or shaming you for going to them for their supposed expert advice, then you need to go to their higher ups, unless they work independently. There's a higher up. Most physicians work for a clinic, and then there's also your insurance company. You can make a complaint against that physician or that provider, excuse me, with your insurance company. And that is how change is made. It's not just being crappy and bitchy, making a complaint. This is what people don't understand. Change doesn't happen if you don't say what's going wrong. I learned that as a nurse. If I even wrote up myself, I did a medication error and I wrote myself up, because that helps policies and procedures be changed for safety. Well, it's the same thing with doctors. If they are not being quality physicians and they are not treating you in a decent way, you have avenues. And I think that's what we need to do more frequently than we do, is to go through those avenues and to make those complaints or statements so that it's brought to that person's attention that, yeah, that was a big deal. It wasn't just you being a crappy person. You're in a professional position and you're dealing with people's lives. So, if you are gaslit by a doctor, I urge you, follow up on that. Talk to the people who are paying that doctor. Talk to the clinic that they work with. Be calm, be respectful. Explain to them, I'm only making this complaint so that changes possibly could be made, that this doesn't happen again. That's it. Anyway, that's my little spiel for the night. I've got some chicken stock on the stove. I hear my beeper, so I gotta go. All right? You all have a great day. Peace. Love ya.